keep a little thing of hair.
Tell them.
Got your,
Oh no, they said they're happy with your bees.
Predominantly we're involved in screening for hepatitis B. So for all clients that are at risk of hepatitis B, then we will take a blood sample from them to check what their immune status is and to see whether they've been exposed to hepatitis B, and then we will offer the immunisation for them as well. So that's our main role. If somebody is testing positive for hepatitis B, then we'll give information about where they are in their journey, I suppose, with hepatitis B, and we can also be involved in treatment. Well, that's fairly new for us as a sexual health department, because obviously we're not a liver clinic, but our main role at the moment is around sort of monitoring and supporting people with Hep B.
when those very close-fitting lycra outfits arrived at our service, I thought nobody is ever going to want to get in those. But it's funny, you know, people elbow each other out of the way to get in an STI outfit, and I think it's because, for one, here in our service we really love our work, and we're prepared to do anything, I think, that will catch a little bit of attention. You know, you get in the outfits and walk out there under the trees, everyone in the whole building is looking at us and having a bit of a laugh, and I think if you can have a bit of a laugh, that's a great way to start conversations.
I think there are always issues around shame and fear around most infections, particularly within sexual health, because of a lack of knowledge within community, and often for people feeling so bad, you know, they are, I've got this virus and it's within me, and how they sort of feel about, how that makes them feel about themselves.
The characters were very much developed in a partnership with the Queensland Aboriginal and Islander Health Council, Quake, the Two Spirits Aboriginal and Torres Strait Islander program with healthy communities here in Queensland, and Queensland Health. So it was a collaboration that brought the suits, but certainly the Condom Man comic book and character was developed from Aboriginal community engagement and community leadership. All cultures see the importance of arts and culture to communicate health promotion ideas, and we look to involve a range of different ways, whether it's music or theatre, or to communicate health promotion messages and engage with people. I think it's quite boring if it's just medical information. I
suppose for us it's around education, to try and break down the barriers so people access services, so they'll go to their GP and ask for screening, maybe around hepatitis B or other infections like HIV and syphilis and sexual health infections. So I think our job within healthcare is to make sure that we're warm, welcoming, accepting, and also provide up-to-date good information.
The nice thing about those outfits, even though I'm a little bit uncertain about Hep B being shown with other STIs, you know, acute Hep B in adults is sexually transmitted, and you know, chronic hepatitis B, I like to think of it as more of a family and a community issue, and I don't want to start getting a bit of stigma in there. But actually, it's nice to see Hep B in there with the other STIs, kind of out and about and having fun, and you know, just a way to normalise the conversations about chronic Hep B.
Hello Bart, how are you today?
Good, thanks.
Now, you know we saw you a couple of weeks ago and we had a whole heap of blood tests done.
Yes.
So, to see if there was anything came out. Now what's come out is that you've got some abnormalities on some of your liver tests.
Okay.
And one of them is that we did screening, you know, we were going to test for all the hepatitis, the inflammation of the liver test.
Yes.
Well, one of them's come back positive, and it's called it looks like you've got hepatitis B. Now, do you know anything about hepatitis B at all?
No,
No,
not at
so
all.
you really don't know. Do you know any of your friends, relatives have hepatitis B?
No.
No.
We don't at the moment have a current prevalence figure for Hep B in the Torres Strait. What we know is that in the mid-80s, before the introduction of vaccination, about 11% of children and antenatal women had chronic hepatitis B. And we know that with the study that we did recently, we identified somewhere between 200 and 300 people in the region who have chronic hepatitis B, and that's probably approximately 3% of the population, but we're doing some further work on that to actually get a true prevalence figure.
Hi, my name's Nikki Newley Guevara. I'm a descendant of the Wutiti people in Shelburne Bay and also Darnley Island in the Torres Strait. I went to university and studied art, fine arts, and that's where everything started happening, was with the art, because I used it like therapy. Every time I sat down and painted, I was thinking about my life and what was the next steps I needed to make. Hepatitis Australia was offering grants to work more effectively in Aboriginal and Torres Strait Islander communities, so we applied for one. And what we applied for was to go far north and do some education around hepatitis B, because in the far north, hepatitis B is more prominent in Aboriginal and Torres Strait Islander communities. What is hepatitis? Where is your liver? What it does? How do you catch Hep B? I'm up in Thursday Island for 3 days and to cover the whole community about viral hepatitis B. When I go into Aboriginal communities, I work closely with the health workers, sexual health workers, Indigenous sexual health workers, and I like to go in and make sure that they're upskilled with viral hepatitis as well. So I offer an info session. It goes through about an hour, so it's just giving them all the information that they need as health workers to be able to work more effectively with the community. So the community workshops are different to me coming in and upskilling health workers. It's more of a laid-back environment for them to be able to have some awareness about hepatitis B. And it's basic awareness, but the key point I want to get across to community is the importance of treatment and management of Hep B. I talk about the importance of vaccination in their community, make sure that they're vaccinated, the importance of knowing transmission if you're not vaccinated, and then the importance of monitoring. So if they're living with hepatitis B, it's really important that they come into their local health service and be monitored. I thought, why not use art as a medium to educate people? And that's where it all started. So now I think that we've worked in about 60 to 70 Aboriginal communities throughout Queensland. When I come in to educate, I like to try and lessen that stigma, lessen the shame, and I think by them having a role model in the community that can get up and talk about it and also open up and say, well, I've lived with hepatitis, and I can associate some of the symptoms with how I felt. So I always come back to, well, when I had it, this is how I felt, you know, and I always say that once I was cleared from hepatitis, my quality of life is 100%. Me getting out into the Aboriginal communities and doing what I do, it's passion. I've got a strong passion towards making sure that people know about viral hepatitis. I mean, once you've lived with viral hepatitis, you do know the importance of knowledge around it. I measure the success of this work through evaluations. So every workshop that I deliver, I evaluate, and I also get the knowledge at the start of the workshop, what their knowledge is around viral hepatitis by a series of questions. Simple questions, they're just basic 5 questions. And most of the time they'll just look at it and go, oh no, I don't know. But then you lessen their anxiety about that and you say, it's okay. If you don't know, you just put, I don't know. That way I know where I'm starting at. And then at the end of the presentation that I deliver, then I give them the same 5 questions. And that tells me whether they've got that knowledge. At the beginning I noticed no one really knew what Hep B was. By the end of the workshop they do. So I'm happy with that outcome.
But what we're looking at, we want to look at investigators to see if the infection is such that we need to treat it. That is, there is a treatment for it, but it's a long course of tablets.
Okay.
However, the whole process of compliance is education of the patient to understand the importance of taking their medication. And that's a long and it's a long process that requires appropriate and adequate staffing to have the time to do that with patients. And not only the clinical frontline staff that are looking at acute illness as well as chronic, but the education component and the education staff within the district. Don't be too worried about this. If you do get worried, don't hesitate. I'm here all the time. Just come in the centre and come and see me. And they'll either say, John can see you soon, or it might be tomorrow.
Okay. No.
Is that okay?
Yeah, that's fine, doctor.
Okay, thank you.
Thank you.
It's a little bit easier to talk about hepatitis B now that there's a national strategy. It kind of gives a bit of direction, gives a mandate really for starting to talk with communities about it. For hepatitis B, in all levels of community, it tends to be a pretty new discussion. So it tends to be a new discussion for health workers, for nurses, for doctors, for clinical management, as well as for people in the street. So in that regard, it's quite simple because it's new for everybody and everybody's learning together, and I'm still learning as well.
One of the things that was really clear was also that the staff didn't actually feel confident that they knew enough about hepatitis B, and so they didn't feel like they were enough.
I think this is a very important issue to address. I know that in the Torres Strait there are also many other health issues that people are dealing with, and so it's one of many conditions, but I think hepatitis B has been a neglected disease to some extent, and I think it's up to us to catch up with the new developments that have occurred. I think many clinicians, when they studied medicine and for many years, there wasn't actually that much that you could do for hepatitis B, and now there's an increasing body of knowledge about things that we can and should be doing, and it's time that we actually took that on board and did it.